Good afternoon and welcome to the second webinar of COVID-19 webinar series organized by IQAC, Sri Venkateswara College and All India Institute of Medical Sciences, New Delhi. I am Dr. Vartika Mathur, Assistant Professor of Zoology and IQAC member of Sri Venkateswara College, and I will be hosting this webinar along with Professor Ambuj Roy, renowned cardiologist at AIIMS, New Delhi. COVID-19 has brought with it the feeling of uncertainty and panic, as well as an innate fear of losing our loved ones. To add insult to the injury, we are under lockdown already for more than a month, which has by now brought a certain stress, depression, and a feeling of worthlessness for many of us, as we are not allowed to work, socialize, or have any outdoor physical activity. And what's worse is that we don't still see the light at the end of the tunnel. So in this second webinar, we have requested Professor Nand Kumar of the Department of Psychiatry, AIIMS, New Delhi, to talk about various mental health challenges that we are facing due to this pandemic and the resulting lockdown and guide us on how to cope up with it. The main focus of this webinar will be our individual questions and the situations you are facing during this lockdown. So please do type your questions for Professor Kumar in the live chat, and Professor Roy and I will ask them for you after the talk. With this, I now request Professor Nand Kumar to take the floor.
Good afternoon. I'm going to speak regarding COVID-19 and mental health. I'm Dr. Nand Kumar. I'm Professor of Psychiatry in AIIMS, Delhi. We all know that mental health is a very important component of our health, and mental health is basically it's the way we think, feel, and act, and it also helps the way we determine how we handle the day-to-day activities, and how we handle our stress, and how we relate to others, and how we make decisions. So all our day-to-day activity, our feeling, our emotion, that depends upon the mental health. I would like to clarify here that mental health is not mental illness. It's mental health, just like a physical health. So we need to understand this. And this is important in every stage of life, like ranging from childhood to adolescent, through adulthood, and so on till we survive. Mental health is very, 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 very important. So even our relationship that depends upon the mental health, and our ability to enjoy the life and to attain the balance between so many things what we do, that depends on mental health. So it's important. So any activity that affects our mind, that affects our sensory system, like our eyes, ears, skin, that affects our mental health also. So if the mental health is affected, what actually happens? It leads to a lot of stress, it leads to a lot of anxiety, it leads to depression, that means very feeling low, feeling worthless. It also no leads to sadness, it leads to sleeplessness. So if all these things comes up because of anything, because of any pandemic, epidemic, because of any stress, so we call that there is a mental health problem. In any pandemic like COVID-19 or any pandemic or any epidemic or any major stress that is the nationwide, it affects the mental health. So why the pandemic is so important for any mental health, and how why mental health gets affected? You must be noticing that since this pandemic has come down, there is a tsunami of information that is going on since at least 2 or 3 months. And within this information, you always have some misinformation, rumors, etc. from so many channels, medias, and social media. This also used to happen earlier, say, few years back, maybe 50 years back, 20 years back, maybe more than that. But why this time it is very troublesome? This time it is troublesome because of the social media is very, very popular nowadays. Almost everyone is on social media. And because of this social media, the information is getting amplified, it is getting multiplied. And information is moving very, very fast. It is perhaps moving faster than the virus moves. Suppose virus is moving from China to India, but information can move from China to India in a much, much faster way. And the role of media is very, very important. In fact, media gets ahead of the evidences at times, and that also creates a lot of or anxiety or mental health issue, because we may have difficulty in handling that. What I'm observing this time, no, in terms of this pandemic, like we have seen the pandemic of SARS, we have seen the pandemic of Ebola virus also before that, SARS one. In this pandemic, there is a phrase, it's called social distancing, that is very, very challenging for the mental health, because all our mental health that depends upon the social connectivity, social support, emotional support, and social support and social connectivity is very key principles of effective management of any pandemic, epidemic, and disaster. But unfortunately, this time we have to be separated physically or socially as per the guidelines of the WHO and as per the guidelines of the government of India. So this time it is very, very challenging to maintain our mental health. So when there is a this kind of challenge, like we have to maintain social distance, we have to disconnect from the society, we have to maintain physical distance, there is a lockdown. So what happens, there is a multiple psychosocial response of the pandemic that we observe. And what we have been observing is that there is a lot of heightened anxiety, increased anxiety, and leading to acute stress reaction between the people and among the human beings. There's a lot of fear, there's a lot of panic, and these all are because of inadequate information. For example, we have seen that in Sabdarjung Hospital, the person was conveyed that we are having the coronavirus infection, and the person basically he tried to commit suicide, he jumped, and actually his COVID test was negative. So this is a kind of way of handling the information to the public that affects a lot in terms of mental health, and that also may take a life or of the person. And if you look at the lockdown part of this pandemic, like social distancing and complete lockdown, that is leading to a lot of boredom, a lot of isolation, and there is a lot of loneliness. And because of this boredom, isolation, loneliness, there is a fear and anxiety. And this isolation, loneliness, and fear, it is a recipe for mental health problem. So that is the reason we are observing a lot of mental health issues, ranging from sleep impairment to anxiety disorder to adjustment issue within the family members and within the business also, panic disorder, and one more condition that is commonly being observed in obsessive compulsive disorder. There is a fear of contamination of the virus, and people keep on washing the hand repeatedly. In fact, I have seen in some media also that it was being advised that we should keep washing our hand every 20 minutes. I think it is a kind of misinformation, because once you are at home, you are in a safe place, you don't need to keep washing your hand every 20 minutes. If you're going out, if you're getting exposed to in the office, then you can perhaps keep washing your hand every 20 minutes or so as per the guidelines. And because of this lockdown, we are also observing depressive mood, depressive disorder. Depressive disorder means that a feeling of low irritability, there's a feeling of worthlessness, feeling of loss of power. You're not able to do anything out of the house, and that is leading to a lot of mood swings. And at times, it also leads to harm to others because of the irritation, anger, and at times also self harm. And it is being reported from so many parts of the country. So, if we are developing all this, though we should be aware that something is wrong with our mental health, and we should be careful. I would just like to explain what are the some early signs of mental health problem. If you think that these signs are there with you, or the symptoms are there, then perhaps you should be aware, and you should talk to someone who feel can resolve the issue. Like some symptoms are like sleeping or eating too much. There's a lot of sleep, or there's too much of sleeplessness. Either you are eating too less or you're eating too much. There is also distinct mood changes in mental health problem. There could be feeling of fatigue all the time when you are not working hard also. There could be withdrawal behavior. There could be feeling of worthlessness. There could be feeling of thinking of harming one own self or others. And there could be the possibility of emotional instability and fear and suspicion also. Suspicion that you may get infected with the virus, or you may infect others. And we have also seen that a lot of increase in alcohol abuse and nicotine in this lockdown. And when people are not able to get this excess alcohol and nicotine, they have the problem like withdrawal symptoms, sleeplessness, irritation, anger outbursts. So if these signs are there, the person should contact the doctors available to them. So if we observe all this, what we can do, what can minimize the stress and psychosocial problems? The lot of measures could be there. I will start with the quarantine. Majority of the people know who are not tested positive, but they are quarantined, and this number is basically a huge number. The quarantine, we all know that depends upon the so many clinical condition. Like if you are getting exposed to the person who is tested COVID positive, you will be quarantined. If there is a suspicion that you may have the uh, contacted the person with quarantine person, then you may be quarantined. So quarantine measures basically that there is no proper guidelines in uh, majority of the country, including India, and it varies from country to country because quarantine is something new, in fact. And what we have seen that most of the person who goes under quarantine, they may develop the stress reaction, depression, or there is a one condition what we call post-traumatic stress disorder. In this clinical condition, the place in which the person is quarantined, that keep coming in the mind, in the vision, and that is very intrusive, that keeps bothering the person. The way the person is taken to quarantine, the way they spend time over there, if they have some difficulty over there, some challenges, so these things keeps coming in the mind, and there is a lot of other issue like sleeplessness, anxiety. So during the quarantine, it is important to understand that they are in a safe place as much as possible as the government can do, and they have to stay there for some time, not for longer time, maybe for 14 days, not more than that. And after 14 days, they can manage, they can go out. So it is important that they should be staying positive, they should be stay focused and stay strong as much as possible. So, if you are quarantined and there are a lot of steps that we can do. I will begin with that if you can't go outside, or you are in under quarantine, then you can go basically inside. You can perhaps do breathing, you can focus, you can explore yourself, you can think about yourself, and once you are calm, cool, perhaps you can find out the way how to manage time in the quarantine. And you can also stay connected with your social and family network by technology if available to quarantine facility, because quarantine facility differs from place to place. And if possible, if you're under quarantine, home quarantine or anywhere, try to keep your daily routine as much as possible, because once you are maintaining your daily routine, you will have the sense of control over your life, and you will have the uh, pleasure of doing something, achieving your goal. So that is very, very important. If possible, keep exercising regularly and practice some habits that you enjoy and find relaxing if it is permissible within the quarantine place. And if there is any problem, try to seek help from the person who is handling the quarantine, including the doctors, nurses, or even social worker if they are available. We have seen that during the pandemic, the fear is very, very central emotion. All our behavior, whether it's just talking the food, groceries, or in a toilet paper, that depends upon the fear that what is going to happen next. So it is very, very central emotion, the fear. And why fear is there? The fear is there because of increased anxiety, excess anxiety. It is important to understand that anxiety is very, very important. If you are not anxious, you will not take care. You will not maintain social distancing also. So anxiety is a normal emotion that we need to understand. But if anxiety becomes excess, then it leads to the fear. And if the fear become unreasonable, it leads to distrust. Distrust among the people, maybe in the family members, community, society. And if there is a distrust, that leads to suspicion. As I have mentioned, suspicion of getting infected our own self or getting or going to infect others. And this leads to bias and agitation. If there is bias and agitation, that leads to behavioral abnormality like odd behavior like spitting on others, irritation, anger, violence, so many things. So we need to understand once there is a more anxiety, and we should be able to realize that, and we should be try to cut it down. And how to cut it down? The best way to cut it down the anxiety is to have a awareness that you are anxious. If you feel that there is increasing heartbeat, palpitation, sweating, you are feeling uncomfortable, just do the breathing. Just count 11 times deep breathing. Like take a long deep breath and release it slowly. Do it 11 times, you will feel that anxiety is going down. It has a biological mechanism, it relaxes the parasympathetic nervous system. So you can reduce the anxiety, and by that, you can reduce the fear and also other symptoms. So it is important to understand the facts that, like what we have mentioned, the fact always minimize the fear. Like, no, there is no point in working at the home and putting it the mask. To, you have to understand, like, a lot of myths are moving. Like, in fact, even at home, you should be with the mask, face mask, and no other measures. No, it is not required. We are under safety of the home. So you have to have the factual information. Then in this lockdown period or in this pandemic, it is always important to return to yourself, because we must observe that what we have been lacking since so many months and years. This is the right time to perhaps do that. Suppose we might not be able to do something, when there was no lockdown, there was no social distancing. We might be missing the family, we might be missing our hobbies. Perhaps we can reactivate that. If we don't have the hobby, perhaps no, we can explore our own self. We can think about our own nature, our own health, what we have done to our health, perhaps what we can think to restore this self. And since social distancing, social isolation is associated with poor mental health, we need to be connected emotionally to the people and socially. And it is highly appreciated that we keep on seeing a lot of people are helping others, like even the police personnel distributing food to others. A lot of social organization, they have come up, they are distributing ration and food, cooked food to others. So this simply means that we are doing well, and we can do perhaps better than this. So it is important that we should be socially connected to each other, our loved ones, and the member in the community, and the family. And fortunately, we have a lot of technical tools also, that like so video call and a Skype, Zoom, that perhaps we are picking up. But I would like to just add here that we should not be too much on the screen, because that also creates a problem, and you develop feeling of irritation. Another thing that we should shift the narrative away from the number of deaths toward the number of recovery. You must have watching the news or reading the news, like 13,000 people have been corona positive, COVID-19 positive. 400 people have died. What about rest of people? They have recovered. They are recovering, and 80% of people, they recover. So only thing that we need to avoid the contact with the person. We need to maintain social distancing in reasonable, adequate way, and we should shift the narrative. It's not only corona does not mean only the death, but you must avoid getting infected with the coronavirus or COVID-19. Then a lot of online tools and services also offer support and connections. Like in Arogya Setu app is there, the government of India. There's so many website and app. There is one app by Mental Health Foundation India. No, they are supporting. They are trying to do their best. So if any issue you feel like, you can always connect with this app, and you can get your queries, problem resolved. So thank you very much. I think we should positive. Uh, of course, there are a huge number, but we have been doing something like the most important thing is the education part. Like they should be aware that COVID is a real illness, but we can prevent it with the appropriate precautions. So with right kind of precautionary measures, we can prevent the COVID, and they should not have the much worry. Remember, some worry is important. Without worry, no, you can't survive. Some worry, unless you have some worry, you can't take the precautions. You can't wash your hand also. You can't put the mask also. You can't take care of hygiene also. The worry is very important, but worry should not be excessive worry. So I think what department has done, what Professor Ambujad asked, our department has made some small brochure manuals and educational materials that is on the website also. In NAME's website also we have some information booklets, some information is there that is very helpful for those person who want to know about the COVID infection and COVID pandemic. Because the most important part to handle any epidemic and pandemic is, as I have rightly mentioned, is the proper information. And the right kind of information is there with the AIMS website also, in our department website also. So we should know.
And are you using telemedicine to?
We are using telemedicine. Our department, those patients who are registered, who are in the follow up, they're using telemedicine. Anyone can log in to the AIMS website and take the slot for telemedicine daily from 12 o'clock onwards. We are doing that, and it is easily available. So, yeah.
Thank you for that information, sir. Asta Devan is asking that this uncertainty associated with COVID-19 is very scary, and how to remain motivated through, like, towards life, especially during the lockdown period.
If anything that is uncertain, it will create anxiety, create a panic. No, it is very natural. So first we have to understand that it is not uncertain. It is just certain that no, the lockdown is there for maybe 2 weeks, 3 weeks, 4 weeks, 5 weeks, but it is not for eternal time, not for a very long time. So there is certain limitation for the lockdown, as you must be listening to the news channels also and the government information also you must be going through that lockdown is going to over maybe in a week, maybe in a 10 days in a staggered way, but it is certain that lockdown is going to be over. So please don't be uncertain about something. No, and COVID infection is also not it is going to last for lifelong and no, all throughout the entire time. It is also going to be contained, maybe no, in a month or 2 months or 6 months, something like that. Only thing that we have to be protective, we have to take precautions so that we can take care of ourselves and our community.
But it's never going to be, for a long time, it's not going to be extremely normal as it was pre-COVID time.
See, we don't know that. A lot of people are saying that COVID is going to change a lot of things in the future. But I think if the COVID is going to change something or a lot of things, that may be positive. Like with the COVID, what we have learned, we have perhaps rekindled our sense of hygiene. We are more hygienic. We are focusing more on personal hygiene. We are changing our behavior also. We are becoming self-reliant also. We are not now depending a lot on the people, and perhaps we are taking care of our own self in a much better way. In fact, domestic help is also reduced, and we are trying to take care of our health also at home by doing some exercise, by doing yoga, by reconnecting with family. So look at the positive part of this COVID infection also. And I have personally seen, I have personally experienced that it is possible to change in the adversity. So COVID is adversity, and adversity always help to make you more flexible, to make you more resilient. So let us take some advantage of the COVID as much as possible.
I think there's a lot of anxiety, understandably, and there's a guardian who's been asking what should we do when the students return to the campus, and students and parents are likely to be anxious about their health. So we know, in young, this disease is very practically there's very little to worry about, right? So some of the fear is overheated, I would say, overbuilt. What do you like to say?
I totally agree with you. No, this fear is basically for any pandemic, the fear is I think more pathological factor than the real illness. In fact, like what the question is that the students when return to the campus, there is a more anxiety.
Yeah. should the parents be anxious
See,
about
the human behavior that depends upon the conditioning. Like no, now if the lockdown is increasing for 1 month or so, we are more conditioned to be at home. So once we go out, it may take some time to know again get readapted to the situation. But I feel that like in most of the government setup, in college setup, university setup also, uh, the administration should take some measures. For example, there should not be flooding in the class. No, there is some physical distancing should be there in the canteen or in the no place of the play. Like no, some classes may be online, some classes may be offline. So some measures should be taken. I think we are preparing also that. Like in our OPD also, we are getting ready to open the OPD, but no with total precautions that physical distancing should be there and there should be proper hygiene. This number of patients should be allowed. So we all are taking no some measures
COVID
to do that.
etiquettes, if I can
COVID,
say,
a very right word, COVID etiquette. Yes,
have to be maintained,
perhaps.
and we have to. This is a long haul. It has to be done for
COVID
over a
etiquette.
year.
Yes.
And as you said, good hygienic habits, if we can convert them for life, there are a lot of positives may come out of it.
Yes, I think somebody has very rightly said, no, the world is changing. The world is changing maybe for the good. Because now that totally depends upon the perception. If the world is changing and you start perceiving that the world is changing for the worst, then the worst will come. If you are perceiving that the world is changing, let us do something positive. So it depends upon that. So my one advice is that lot of news channels and no social media, they keep on showing that no there's a lot of issues are coming up, the illness will increase, everything will be destroyed. So please don't watch that. Look at the positive aspect of something, and I think things will naturally improve. Anxiety will go down, but some anxiety it is reasonable and it is normal. If there is no anxiety, that is a problem.
That's true. Sir, many people, B. Chandra S. Rao, Varun Mathur, Shalini Sen, Vijay Lal, all these and many more people, they have been asking that during this lockdown period, especially now with the hotspots still probably it's going to increase, the lockdown is going to increase a little bit further. How the elderly people, because we put put them in their mind that they should take a walk, they should exercise a bit because they don't have a lot of office work, and how along with them to keep inside small children. So how to balance that situation for the people along with all the house chores that they have to do.
So good. Look at the other aspect. No, what elderly basically wants. Elderly wants that somebody should be there with them, so that they can talk to the family members. So it is a good time for them. They can talk to the family members. They are available, in fact. So this is important. No.
But
We keep
it's a
on
drastic
saying
change for them suddenly.
sudden changes there. So it's a flooding basically
Yeah.
that we need to handle that flooding. But no, we keep on saying that elderly are at risk. It's a true, but it's no. We have to be cautious here. Like some elderly who are 60 years of age and they have very good health, they are not that much at risk. Like those adult person who are having the other illnesses like comorbid condition, what we technically call. Like if some adult is having the fever, there is a history of bronchial asthma, there is a history of smoking, alcohol, drug use, they are more at risk than elderly. So the elderly also can know.
Age is not
Age is not
chronological
that.
It is not the
age,
only
it's,
criteria.
biological age.
Yeah.
Yes, because we have been seeing, that the
That's-
people who are elderly, they are coming up with the COVID infection,
Yeah.
and the adults are dying. So it is important that know how much your immunity is good, how much good immunity you have. So it is no, it should be considered. In fact, it's important. And elderly can communicate. Like see, it's a again I will use the word resilience. It's a family resilience, like personal resilience. Like I have some resilience, I have ability to bounce back with some adverse situation. So family resilience is also there. The family can also bounce back. So it is a time to see how much resilient your own family is and community is, so that you can bounce back from this phenomena, or you can adapt, or you can respond as per the situation, and that helps in being more mature in terms of your own individual personality and the family also.
Yeah, you rightly said family support at this point.
Family support or family
Extremely
resilience,
important.
family dynamics. I think a lot of things are positive. We can look into that. Like elders they like very much to tell the younger generation what happened in their generation.
Yes.
So it's good to listen to them. Perhaps no, it's more than
Gives you time to
Now we are
spend with
creating
them.
memories.
it's more engaging. It's more engaging than the Facebook and WhatsApp.
Absolutely.
Perhaps.
There's one question actually the same parent asks Shikha Jain is that it's again about her students in IIT, and because of this current situation, it's a very specific question. The companies have put jobs on offers on hold, so the students are quite depressed and frustrated about. Would you like to give some tips to these students?
Uh, I would like to convey that no, it is on hold. The job is on hold. It is not vanished. So job has not disappeared. They're going to get job. It's a matter of time. Maybe there could be delay of 1 month, delay of 2 months. So by that time, they can spend in their own way. Of course, not using drugs and not getting engaged in some abnormal coping mechanism. Of course, they can explore themselves. They can do some physical activity at home. They can connect to their friends. They can do whatever they want. See, we all have different kind of
pick up some
personality.
talents which would help them
Pick up
improve
some
their
talents, yes.
chances for
So-
them now. So many online courses.
So
which
many
can help
online
them in their
courses,
job
and most of
futures.
the courses are, I think, free. In
Yeah.
fact, no. So we can brush up. We can brush up. We can think about our own self, what our interest area is, and what we have not been able to do since long time. We can do that. But job is on hold. It has not disappeared. So it's just matter of time.
Sir, a lot of people are asking about the people who are already having some like OCD or other schizophrenia, other these kind of diseases, mental disorders or problems, and they are unable to contain themselves at home. For them, the family dynamics, the home dynamics have changed a lot. So, how such people should cope up with
It's a
this period?
it's a very difficult situation. In fact,
Yeah.
why difficult situation? Because already they are having no on some medication. They're on some medicine, and there is added a stress of being at home only, not going out. And for any mental health problem, the social connectivity, social support is very important, and that is perhaps no affected in this lockdown period. So I would suggest that they should be able to continue medicine as much as possible. There could be practical difficulty in obtaining medicine because of the lockdown, because a lot of clinics are also closed. So they can always be in touch with their doctor, psychiatrist. And I think the government has recently issued some guideline that these medicine, the medicines, no psychotropic medicines or any medicine for mental health problem, it can be available in the soft copy. Recently, the government has issued this just 2 weeks back, 10 days back. So their doctor can always prescribe on the WhatsApp or email, and they can get the medicine. I think that
You
that
can
is
make
not a
use of the
problem.
new telemedicine guidelines,
So,
especially
plus-
if you're a
yes.
chronic patient and you want a
Yes,
refill of your prescription.
yes.
so
The prescription can be refilled. It was not available earlier, but now it is there. Those patients who are in our follow-up, in government hospital follow-up, they can use telemedicine facility to refill the prescription.
So one more question, one that is my question is like, suppose somebody is diagnosed with COVID, and as you said, you're taught so much of anxiety about the disease. How should he handle this diagnosis? It's a very important thing when it hits you. It
Yes,
hits you hard.
yes. The anxiety is there. Some anxiety is normal also, but if anxiety is no little too much and you are not able to handle it, suppose no, if there is a lot of anxiety, sweating, panic attack, and no palpitation, tremors. So if the anxiety is increasing and you are not able to sleep properly, then I think you should take care of this. The best way to handle anxiety is to control your sympathetic activity. Anxiety is mainly because of overactivation of one nervous system, what we call sympathetic nervous system. Dr. Ambuj is master of that. So once there is more activity in sympathetic nervous system, they are more anxious. The best way to calm it down is to do breathing exercise. The breathing means slow deep breathing. Like I will just show you. Take a long deep breath, release slowly. So what happens once you take a deep breath, it increases the sympathetic stimulation. Once you take a long deep exhalation, you just exhale. So it leads to relaxation. So what it will do? It will modulate your nervous system, autonomic nervous system. Once it is modulated, you will calm down. If you are not able to manage it, then try it at least for 11 times. 11 times, maybe 21 times. Take a long deep breath slowly. If still there is difficulty, try abdominal breathing. Like breathing only from the abdomen, little moderate breathing, and that also helps in calming down the sympathetic nervous system. So these the small things we can do, even if the anxiety is not responding to that. So you can talk to some doctor for medication, or you can talk to some of your friends perhaps.
And you should understand that 80% of the people will have just a mild or very
Yes.
mild disease.
So
Another
anxiety is not abnormal. Anxiety is a normal part of life. We must understand this. So if some
when it
anxiety
gets
is there,
diagnosed, most of the people, as you said, even young, I mean, 90% of the people will have very mild symptoms. 5% may require an admission, and very rarely in a young person, less than 1% may require very intensive care.
very
And
less,
adverse
very less,
outcome is probably less than 0.1%
very
young
less.
people. So that way they can, I think people physicians should
Yes.
talk to them and
So,
allay their anxiety.
so information is very important. What Dr. Anbu is saying, that most of the infection is mild, more than 80% perhaps, and just be aware of this. But that does not mean that you should go and catch the infection. You should have the proper precaution. You should not get it.
So, Alankrita Rastogi, related to that, has asked that if a person is already suffering from depression a bit, should we already increase the dose of the medicine that we are taking on our own, or should because sometimes with telemedicine, maybe it's not possible to reach out to the doctor immediately. So, what should we do
No.
about that?
If we are having depression and you are on medication, that does not mean you should increase the dose. If there is no symptoms are no stable, so there is no point in increasing the dose. If we have difficulty in sleeping, suppose because of the anxiety, perhaps you can do some exercise, some breathing exercise, some relaxation techniques. You can use that, but don't increase the dose of medicine unless it is no advised.
Right, by doctor.
Advised. And if you are aware about your own medication, and you are competent, able to handle it, like some people are able to handle it, increasing the dose, decreasing the dose. So if you are aware, you can try. But if everything is fine, depression is stable, don't increase the dose.
I think there's one more question is for children. This is Ranjana Roy, which says that our children are real unsung heroes in these tough scenarios. They need open spaces to play, which is very right. How do you explain the situation?
I really appreciate that the words he has used, unsung heroes. See, it is best time for the children. You may or may not agree with me. Why it is best time? The children's brain are very plastic. It's a quite resilient brain. So this is the best time to inculcate some good habit in them. It is best time to talk to them, and we have talked to a lot of children during this COVID episode, and they have devised the way, in fact, better than the elder person. Only thing that we have to listen to them. You just listen to them, give them some work, and this is the best time to teach. Perhaps we have seen some children teach some yoga, some skills, and the hygiene and routine sort of thing, maybe some discipline. And a lot of children are there who may complain that we have to go out. If you give right kind of information, see, this is just a few days, maybe 1 month or so, you have to manage like this. So they can manage better than the adult, in fact, what we have seen. So they are real unsung heroes. Once they go to the school, this is the question also.
Yeah.
Once they go to the school, I think schools are getting prepared to handle that. Like they're not going to get flooded with the students, so they're going to maintain that. I think maybe the division of the classroom also, maybe into the one class, less number of children. So something is being done by the school authority. So nothing to worry about that. But I really appreciate the children are unsung heroes. I have.
In this aspect, I think AIMS has done a very fabulous job of developing photography clubs or chess clubs,
Yes.
as you would have seen.
Yes.
And they've extended it to the faculty and its members.
Yes.
So people will develop in whatever interest they have. They develop several clubs and you could join and be playing from a distance. Nowadays, you don't need to play chess. You don't need to be
Yes.
physically around.
that's
You can
true.
play it from anywhere. Your children are playing games right from in the neighborhood, sitting poles apart.
Yes.
But sir, you said children's mind are plastic.
Yeah,
That
they're
is
very
that is
plastic.
that is so right. But what about the parents' minds? Me as a
They,
parent,
they,
we are still
no, no.
not so plastic, and we are used to this
No, no.
mechanical way of
Naturally,
sending children to
once you
school
grow,
and
the brain plasticity little becomes affected.
yeah.
But if we are able to listen to them, and if we try to go back to our time, that may also help to become more resilient, more plastic, or to make our brain more plastic. And of course, other activities like physical activities, what Dr. Ambujalo suggests, physical activity, other mental activities, and exercise and breathing, yoga, it also helps to make brain more plastic.
But how to come out of that mindset of like the child should study at this and this time, and okay, there are online classes, but still we are
Awareness.
unable to adapt to that.
Awareness.
Yeah.
One has to be aware for everything. Like if I am aware that no, this situation is there, I will be able to handle it. If you are aware that child is having difficulty in doing that, then perhaps your anxiety will go down, irritation will go down. No? But what we just want, okay, I have tell you, you should be ready for this.
Yeah.
They may not be able to because they are engaged, so they have to be disengaged from that particular work to be engaged to other places. So we need to understand that.
Yeah, that's true.
I think the good thing about these interactions is that you get fabulous questions and you keep learning. And this is Chaitanya Jadhav who says that why this wrong term, social distancing? It should be physical
Actually-
distancing, and you need not be socially
We,
distancing. It's a very
Chaitanya, we have been telling this since long time, but no, so many things depends upon the how you pick up the word. Like this word was started from WHO. Then other member countries they pick up the word, but we have been telling since long time. It is basically physical distancing because
Yeah.
social distancing means like we are not maintaining social distancing. We are just maintaining physical distancing, and we won't be able to do this kind of webinar if we are socially distanced. So social connectivity, social
very
support
relevant.
is very very important. I totally agree
And
with
actually,
you.
it's a time when emotional
Yes.
distances have been
Reduced.
reduced. People are
Drastically
coming out with their
reduced.
old photographs or family
Yes,
photographs.
yes.
And
So it's a
seeing
social
that,
connectivity.
So I think
So
emotionally
it's
we've come
it's a
closer.
physical distancing basically, that should be
That's
used.
a good point, and
Yeah, that's a good point. So, many of our viewers are asking how to promote the importance of emotional quotient at this time, like because obviously it's mental stress is not considered as a chronic problem or the disease in India. It's and so right now how to increase that or promote that.
Actually, mental stress is not a disease. Also, I must be honest. It's not disease. It's mainly marketed like a disease because mental stress or physical stress is very very important. Without mental stress, you can't do
Don't feel
anything
motivated.
because stress is an integral part of the life. Like physical stress, if you are doing exercise, going to the gym, it is a physical stress that you are taking and you are managing that stress to build up your muscles. Same thing applies to also mental stress. You take mental stress that is required. Like you study hard, that is mental stress, but there is a goal. The goal is that you have to clear examination, you have to pass examination, you have to take a good job. So that is not the stress. That is basically putting hard work. But we keep on using this word so commonly that it has become some pathological sort of word, stress.
That's
But stress is not that pathological. What is the what problem I understand is it's not the mental stress, it's the mental health problem that people not able to understand. That the difference between this mental health problem and mental health is normal day-to-day activity. Like we get up in the morning, we are feeling good, bad, or irritable, whatever it is, but we become better with the time, and our mood also keep on changing, from day to day to evening. So that is basically mental health that is very very dynamic. Our feeling, our emotion, our action. But majority of the time, what happens, our behavior changes, our mood changes, it start affecting our job, start affecting our relationship, start affecting our sleep, and we are not aware of that, and we start blaming others, either job or relationship or parents or colleagues or administration. So that is bothersome, so that we should be aware of that. So the basic, no, the basic problem is that of lack of awareness. Once we are aware that we are changing, then we can take care of a lot of things.
There's a very specific question from Pradeep Sachdev. He says, I'm unable to sleep for more than 4 hours because of COVID and the strain, I think. And stress levels keep on affecting the mind, heart, there's false fluctuation. Please advise how to come over the insomnia condition.
Okay. My advice is to just know, I'm not aware about your routine, how you spend time during the day. My advice is to just make a routine for a whole day, stick to that routine. So what is going to happen if you make a routine, stick to that routine, once you finish one thing, you will have a sense of achievement. You will feel good. Okay, I have done this. Then finish another thing, then do another thing. So no, spend your day in a meaningful way, as per your situation, whatever you are doing, and then see the sleep naturally will improve. If there is still difficulty in sleeping, then try to have some breathing exercise, before you go to sleep. Not that what we call kapal bhati, just deep breathing, and I think it will help. But most important is just develop a routine, stick to that, and try to achieve some goal during the whole day. Because what happened during this lockdown, we get so lonely and bored. We don't do anything. We lost our routine, in fact,
Yes.
and there is a very poor sense of achievement. We feel the whole day perhaps wasted.
Another question is on the online classes. Punita Agarwal wants to ask, what impact can there be on mental health of children glued to online classes, and what precautions parents can take and should take today and later?
It's a very good question. In fact, I was watching some news just 2 days back, and there is one company of the gaming company. Their business has rose to up to 4,000 crore during this 1 month. So this is again going to be challenging. Why challenging? Because we are mostly glued on the net, social media, and internet surfing. So that we have to be careful. Like online classes means it should be for the classes only. It should be used, and we need to be aware that as an adult also, forget about children, we are becoming dependent on this.
Minimize the screen time.
So and then we are also perhaps going to be affected, like our writing habits and so things.
Yeah.
So we need to maintain some sort of balance, like keep a diary, keep a notebook, keep writing also during this online
I
classes.
think the online school there is a necessity.
It's a necessity,
right
but
now.
we have to make some balance. Otherwise,
For
that may
other
create,
things they can avoid, like games and all can be avoided.
like they should avoid as much as possible.
Sir, Kaveri Chakravarti is asking, what is the role of cognitive behavioral therapy in treating phobia, anxiety, and depression caused by COVID-19, and whether any kind of food therapy or any other kind of therapy would help in
Okay.
this?
Cognitive behavior therapy is basically to change the cognition. There is a cognitive error. Like if you say, if you listen word COVID, and if you relate this word COVID with lot of information available, like death with the COVID and no complication. So that is a negative information that we are having. So there is a definite role of cognitive behavior therapy, but at this point of time, CBT, that depends upon the person to person, individual mostly. Group CBTs, no, that depends upon what kind of group you are having. So at this time of COVID-19, it's more important, more relevant is right kind of information. But CBT definitely helps if it is available, if available. But we're not doing mass CBT for this. Of course, for social phobia, depression, it is very very useful. But as a medical personnel, we use the combination. For mild depression, mild social phobia, CBT is alone enough. But if it is more than that, it's moderate to severe, then we need both the medication plus this. But the second part of the question is the diet, right? See, your immune system becomes better, your stress handling capacity becomes better with certain kind of diet. Those diet that contains omega-3 fatty acid, that contains antioxidants. So green leafy vegetables, these diets are good. In fact, nuts, almonds and others. So they are good component of the diet if we can manage that. If it is affordable, of course, because green vegetables are difficult to manage nowadays. It's not easily available, perhaps. No?
Yeah.
Not fresh one.
One of the last questions is, please, I don't know whether it's a term, something like that, please address how to offer psychological first aid to anxious, afraid, and angry people. Very common emotion
Good.
in these unusual circumstances.
Good question. Psychological first aid is a good concept that has come up in the last 4 or 5 years. No, and psychological first aid is mainly that WHO using for the epidemic, but not this kind of epidemic. It's mainly for the disaster like earthquakes and all that. So for this epidemic, psychological first aid we have not developed by this time, but it is not that very complex thing. Anyone who is anxious, like you have mentioned, anxious, irritated, if somebody is very much irritated, anxious, and if you become irritated, if you respond to that person in a more irritated way, uh, the anxiety will increase, the irritation will increase. It's something like war of nerves. So if somebody is very irritated, anxious, just you just get calmed down, and if somebody is feeling that I am very irritated, agitated, then they should do some deep breathing. They should just try to disengage from that situation. Like if I am angry to you, then I will try to disengage from that situation. I will go somewhere else. Maybe I can have a glass of water. Maybe I can start making tea. So this is important. No disengagement. You just be away from that place, and once you are aware, then you can start thinking of why it developed, and perhaps you can develop your own coping mechanism, how to handle the stress and how to reduce the agitation and anxiety. At times there are some underlying medical conditions also, like some people in some situation they get very irritated, angry. Some people don't get it, so that also has to do with some personality factors of the person.
So, would you advise something similar for people who are addicted to smoking or drinking, and now they are unable to
See,
get it?
that
So,
that depends.
disengaging.
That depends. Those professionals who are into the addiction treatment, they may recommend to know substitution therapy, like moderate dose. But personally, what I feel as a psychiatrist, that is the best time to quit it. Best time to quit the habits, whether it is a cigarette, whether it is alcohol, whether it is something else. If possible, with medical support. If not possible, then with the household arrangement, with the help of family. But first, we have to be motivated that we have to quit, because you can realize that this is the situation when we are not able to manage things, and your life is so miserable now. So this is the best time to quit, if possible. Uh, and lot of ways are there to quit. In fact, no.
Sir, actually, there are a lot of paranoia. Actually, it happened yesterday after Guleria sir's talk that people have been asking that you asked about bakery products and how to handle the things that we are bringing from outside, but you did not ask about fresh fruits and vegetables, and people have been washing these fresh fruits and vegetables with Dettol. So, or these, I mean, they are not sure how to handle and whether if they want to eat something raw. So, how much of it is possible to do? How much is too much of a precaution?
I like okay.
So that's a good question. I think this is again exaggerated
Yeah.
fears. I would say anyway, when you're eating raw vegetables, you should take all those precautions of
Yeah.
cleaning them, putting them in water for a certain time of time. You may use some of the things which are available commercially to disinfect that. But so that doesn't change with COVID times. What do you say?
I absolutely agree with that. No, but the problem is like what is harm? You can easily wash the vegetable, but there is no point in washing the vegetable with Dettol and other chemicals, because it will perhaps be
It will be more harmful.
unhealthy. In
Yeah.
fact, I would like to just convey. Suppose you wash the vegetables with proper water, running water,
Yeah.
it's a sufficient. What happens? Suppose if few viral virus are there, it is not going to kill you. I don't know whether you agree with me or not, because the viral load is very, very important for any infection. If suppose one or two viruses enter into your body,
I mean,
so
anyway, the oral route
so
has
oral
not
route,
Yeah,
been
oral
oral
route
shown
is
route is
to
not
be
not.
oral
have
route is not a route of transmission.
as of now.
So as of now, what research is available, even if no, if one virus goes, in fact, no, that will help you to develop immunity. That does not mean that you keep on eating no without a precaution. Use that, but there is no need to be scared. So no, if one or two virus goes into the stomach or into the nasal tract also, it is not going to kill you. In fact, it is going to perhaps help you in some way. So there is no need to keep on washing it, because no, if you keep on doing it, so those people who are very perfectionists, they may develop the obsessive compulsive disorder,
OCDs, yeah.
OCD, and we have been seeing it. In fact, no, it is happening. In fact, like lot of patients of OCD, no, who we used to advise that don't wash hand repeatedly. Now they are questioning us. You said don't wash hand repeatedly. The world is washing it. So, but no, important is that they are wasting their time. They are wasting their time. Their no, their job is getting affected because of this. So we have to be careful and reasonable. If something is our job, our study is getting affected with repeated washing of hands and repeated cleaning behavior, then we should be careful that it is going beyond one line.
Yeah. And sir, I think I was just reading this morning and discussing with Valeria sir this morning itself that COVID virus is known. There are papers that say that this virus it gets the vitality of this virus decreases at 56-degree temperature. So if you wash your vegetables and fruits with warm water, running water, I think
So
that
it is
would
less
help.
virulent, no?
Yeah, yeah. So it should help. And I think with this. It's almost time, so I would like to thank on behalf of all the AIMS faculty, college, our
Thank you.
Venkateshwara College
I'm so
faculty.
grateful
and
that
students.
we are able to do something,
Yeah.
at least some useful information we are able to pass to the public.
Yes, sir, and thanks to you, I think I'm sure we'll be more appreciative of our time spent with our family and.
So we all should be thankful to Dr. Ambuj,
I think
who is a facilitator, who is facilitating so many things.
such a learning experience for everybody.
Yes,
I mean,
that is
I'm
true.
amazed every time you answer this and you think you know everything.
And then
you
something
learn
new
so
comes
much,
up. Yeah,
from these
I've been
interactions.
reading about this all day
So
today
it's
already.
amazing. And, thank Nand.
Thank you.
Thank you so much. Thanks a lot.
You
Thank
have
you
us
very much.
tomorrow. And
Yes, tomorrow, see you tomorrow for the third webinar where we'll be meeting Dr. Gopi Chandran who will be telling us how to remain fit and healthy during the lockdown period. Thank you very much and have a good afternoon.
Thank you.
Thank you.